Hi, my name is Brittany Williams, and today I'll be doing my skills video on a head-to-toe assessment on a patient who just had a surgery. So I'm going to start by knocking on the door, closing the curtain for patient privacy, and then I'm going to introduce myself. Hello, I'm Brittany. I'm going to be your nurse for today. Can I please get your name and date of birth?
Darlene Williams, 2658.
Okay, can I check your wristband, please? All right, looks good. So I understand that you had a surgery.
Yes.
And where did you get your surgery?
When?
What did you get?
I had my tonsils removed.
Okay. Are you feeling any pain today?
No.
On a scale from 0 to 10, what is your pain?
0.
Okay. All right, so I'm going to do a head-to-toe assessment. That's literally from the head to toe. But I'm going to give you instructions as I do anything, and if anytime you have questions, just let me know.
Okay.
So first I will start with her vitals, which is blood pressure, heart rate, respiration, temperature, and oxygen level. Her blood pressure is 124/70. Respirations are 18. Heart rate is 80. Temperature is 37.6 Celsius. And oxygen level is 98% on room air. So just from observing the patient looks well kept. Her hair looks fine. I don't see any thinness of hair or balding or anything. And then I'm just going to observe her head. It looks symmetrical. Skin looks normal. She does have turgor. I don't see any abrasions or scratches, bruising, or lesions or anything on her skin. Okay, so next I'm going to check her eyes. Okay, pupils are bilaterally equal in shape and size. The conjunctive is moist and pink, and the sclera is white. Next, I'm going to palpate her nose. Okay, nose is symmetrical. Can I have you look up? Okay, nostrils, nose are pink, moist, and theirs are patent bilaterally. Did you feel any pain or pressure when I was touching around your nose?
No.
Okay. So next I'm going to check her mouth. You can say ah, hold your tongue out for me and say ah. Alright. Gums are pink and moist, teeth are intact. Uvula is moving up and down correctly. I'm going to check her lymph nodes. I don't feel any swelling or tenderness, or is there any pain?
No.
Okay. And then also with the mouth, the tonsils are not present because she had surgery, but I didn't see any bleeding or abrasions or anything inside of her mouth. It looks like it's healing fine. Okay, can you swallow for me? All right. And okay, so jugular distension is here, and she can swallow just fine. So next I'm going to have you shrug your shoulders for me up and down. All right, and I'm just going to palpate her thorax. Don't feel any swelling, any pain there. All right, so next I'm going to listen to her lung sounds. Have you had any trouble with breathing or coughing?
No.
All right. Just take a deep breath for me. Okay, just lean up for me. Keep taking those deep breaths. tongue sounds are clear. All right, so next I'm going to listen to her heart sounds. You can just breathe normally. Okay, heart sounds sound normal. I don't hear any murmurs or anything. So next I'm going to start moving down to the lower extremities. Just going to check out her arms. Don't feel any bruising or tenderness or swelling. I don't see any signs of abrasions. Same with the legs. Okay, no signs of bruising or lesions or abrasions, no swelling or tenderness. Next, I'm going to check your range of motion. So if you could just go like this and go in a circle and then backwards. Okay, then I'm going to push your hands back and don't let me. All right, range of motion is good in the upper extremities. I'm going to come down to her feet. If you could just lift your right leg towards me. Okay, when I push back, you push forward. All right. And then your left foot. When I push back, you push forward. All right, range of motion is good and resistance. Next, I'm going to check her pulses. I'm going to start with her temporal. Radial. If she was lying, I will check the femoral right in the growing area. And then your feet, please. I'm going to check the dorsalis pedis. All right, all pulses are 2+ bilaterally in the upper and lower extremities. Next, I'm going to check her cat refill in her upper extremities. If you just place both hands out like that. Cat refill is 3+ bilaterally in the upper extremities. Okay, cat refill is less than 3 seconds in the lower extremities and less than 3 seconds in the upper extremities. Not sure if I said that. Okay, so next we are going to do the smell test. So if you can tell me what this smells like.
Alcohol.
All right, good job. And then we're going to do the whisper test.
44. 22.
Okay, good job. So I'm just going to ask you a few questions. Do you know what city you're in?
Yes.
What city are we in?
Sacramento.
What month is it?
July.
And who's our president?
Trump.
All right, so if I was to give her a rating on the Glaxall coma scale, it would be about a 15. All right, so now I'm just going to have you get up, do a small circle around the chair. I just want to check your gait, see how you're walking. All right, did you have any pain?
Nope.
Okay, so I'm going to check her abdomen next. Have you had any trouble with bowel movements?
No.
When was your last bowel movement?
This morning.
Okay. So I'm going to osculate her abdomen. Okay. Bowel sounds are present and clear. Just gonna gently press down. Do you feel any pain?
No.
Alright, next we are going to do her vision test. So I'm just gonna back up. You can stand up for me and cover your left eye. Okay, and read the first line for me.
E
Second line,
F P
third line,
T O Z
fourth line,
L P E D
fifth line,
P E C F D
sixth line,
E D F C Z P
seventh line,
F E L O P Z D
eighth line,
Can you hold it up? Can't see it.
Alright, go ahead and cover your right eye and read the first line for me.
E
Second line,
F P
third line,
T Z
fourth line.
Can't see it.
Alright, thank you. So if I was to rate this, left eye is a 2025 and right eye is a 2063. Okay, so I just want to take a look at your nails. Okay, nails look good. I don't see any denting or scarring. Okay, just gonna palpate around your ears. Check for any breakage. Okay, ears look pink and moist. I don't see any buildup of wax or bleeding or drainage. Can you turn your head from left to right? Up and down. Alright, good job. Okay, do you have any questions? Alright, so I'm just going to document my findings and then the provider will be in to talk to you. And then after I document, I will perform hand hygiene.